Hello, this is Dr. Van Tine, and I am going to show you the point location of acupuncture points on the forelimb of the dog. We are going to start with the medial aspect of the foreleg, and the first point that I'm going to show you is large intestine 4, which is right here. Large intestine 4 is at the midpoint of the second metatarsal bone, at the most medial aspect of the bone. So some people will tuck it up under the dew claw if there's a dew claw, but it's actually at the midpoint of the bone, independent of where the dew claw is. So make sure that you measure and put it at the halfway point right there on the most medial aspect. Large intestine 4 is a great point for the immune system, used in combination with liver 3. It's combination of points called the 4 gates, which is a very powerful combination to move chi in the entire body to relieve pain. Next, we're going to identify lung 9, which is the influential point for blood vessels. You locate the medial styloid process of the radius, and I find it by going just distal and slightly caudal. It's actually over the artery right there. And again, that's a good point used for bleeding and anything to do with the blood vessels, vasculitis, for example. One way that I can make sure that I am in the right location is if I flex the carpus. Lung 9 moves with the foot, and lung 7, which is the next point, stays with the foreleg and does not move when the carpus is flexed. Lung 7 is the source point for the lung. It's the master point for the head and the neck, and it's located 1.5 soon proximal to the most medial aspect of the styloid process of the radius. This point here, 2 soon proximal to the carpal crease, located, I put it just cranial to the superficial digital flexor tendon, is pericardium 6, which is the point that regulates chi in the chest and is the master point for the thorax and the cranial abdomen. An excellent point for calming the shen and also to relieve vomiting. Moving to the lateral aspect of the foreleg, we find small intestine 3, which is just proximal to the 5th metatarsal phalangeal joint on the most lateral aspect, and it's right over the bone. That point is the opening point for the dumai. It drains the small intestine channel, which is a really good point for the neck. And when you needle this point, usually I put the needle in facing down. It's very, very sensitive. It really stings when you hit the point, so be careful when you needle that. Moving up the foreleg on the lateral aspect, in this depression right here, is heart 7, kind of hard to see the little red dot. That is a point that is very useful for cardiac arrhythmias and tonifying the heart blood. This point here is triple heater 5, which is 2 soon proximal to the crease, the carpal crease on the lateral aspect in a groove between the radius and the ulna, which is really hard to find. You can try to palpate it by finding the radius and moving your finger back. There's a little depression. Sometimes you can find it moving forward and your finger will bump up against the back edge of the radius there. If you can appreciate this here, you can see pericardium 6 on the medial aspect of the left foreleg is at the same level as triple heater 5 on the lateral aspect, but they're actually at an angle to each other. From triple heater 5, you go caudomedially to pericardium 6 because of the relationship of the radius and the ulna. So we have reviewed large intestine 4 at the midpoint of the second metacarpal bone, lung 7, lung 9, pericardium 6, small intestine 3, heart 7, and triple heater 5. Happy needling.